It's informative, it's healthy, and it's the news. Welcome to the Health Connection. This week's special episode, HIV testing in a pandemic.
Hello, everyone. Good afternoon. My name is Kishi Martin, and I am welcoming you to another episode of the Health Connection. So, thank you all for tuning in. I am going to be your host again today, and the topic that we have is HIV testing in a pandemic. Now, 2020 has been a very interesting year. We've seen many challenges with the sudden appearance of COVID-19 late last year, and we have all gone through many challenges. And of course, one thing that we will definitely be talking about today is the at-home HIV testing kits that we can deliver to you, or you can pick up from one of our locations. You can go to careresource.com/home testing and register. We need your consent. We need your information so that we can give it to the correct individual. Also, this week, August 9th to August 14th is National Health Center Week. It is a way of recognizing not only all of the health centers around the country, but the work that each health center is providing for their communities. I would like to thank everybody who works for a health center for doing all the work you're doing, all the essential workers out there who have been essentially risking their lives and doing the best they can for all of their clients and patients. Thank you all so much. You all are wonderful and you are appreciated. So I would like to introduce some special guests that we have. First, it is going to be Rick. Are you there, Rick? Rick Mendiola.
Hi, yes I am. How are you today?
I'm here. I'm glad to see you. Thank you so much for being a part of the Health Connection. So I've already told your name, but if you don't mind, please just tell us who you are a part of and what it is that you do and why you're here.
All right, my name is Ricardo Mendiola. I work for Orasure Technologies. I am the account manager for the states of Florida, Louisiana, and Texas. And I have been working with Care Resource, since 2007.
Woo!
Yeah, so very familiar with the services in Broward and Miami-Dade, or Fort Lauderdale, Miami-Dade, and was happy when I went over to work for Orasure Technologies. Prior to this, I worked for the Florida Department of Health. And moving over, I was still so very happy to continue that partnership with agencies and organizations like Care Resource.
Awesome. Thank you for being here again. I look forward to you sharing with us what it is that Orasure has been up to. 2020 has been quite the year for all of us. So hope you have some really exciting, different news to share with us. Okay. So hold on tight. Mm-hmm. Don't go anywhere. And I have another guest, Jairo Farinas.
Oh, can you hear me?
Of course. Jairo.
How's everybody doing?
We're happy to see you. Thank you for being here on the Health Connection. How are you feeling? How are you doing?
I'm feeling pretty good right now. Had a little technical difficulties earlier, but I'm back on, as you can see.
Can't be stopped. Cannot be stopped, ever.
Yeah.
So we know your name, but please tell us, what is your position? What is it that you do? And why are you here?
Yeah, so my name is Jairo Farinas again. I'm an HIV testing counselor, and basically here to go over basically what's going on right now nationally and locally regarding HIV and the home testing program, which we'll be talking about as well.
Glad to have you. Should we get into it? Should we get started? Are you ready, Jairo?
I hope so.
I need some confidence. Come on now. Come on.
I am. Let's do it.
All right. Obviously, I've mentioned quite a bit of this year, 2020. It's been very challenging. It's been very interesting. And COVID has taken really all of the attention. So I'm pretty sure a lot of people are thinking, why are we even discussing HIV in 2020? Well, there's plenty of reasons to talk about HIV in 2020, and that is exactly what we will be talking about.
Yeah.
So, according to the Center for Disease Control, there are 1.2 million people in the United States living with HIV. 1 in 7 do not know that they are HIV positive. According to the Florida Department of Health, there were in 2018 38,000 new cases in the state of Florida. Sorry.
No, in the United States.
Nationally, yes, that was nationally. Nationally, 38,000. But in Florida, that's the Florida Department of Health, who told us that there were 4,900 new cases in the state of Florida. And as we know, usually the two most populous counties in the state of Florida, Miami-Dade and Broward, they usually are also number 1 and 2 in new HIV infections, new HIV cases in the state of Florida, and also in the country. So
speaking about the national numbers, 1.2 million is, a pretty high number. And then how you mentioned the 1 in 7, that roughly translates to about 14% of those individuals who don't know that they have HIV. And then also when we talk about the new infections yearly, that's you said about 38,000 or so.
Yes.
Thankfully, compared to 2017 numbers, it's gone down, thankfully. It used to be, I think, 39,000-ish, if I'm not mistaken. So that's good news. The problem is obviously that there's still certain demographics that, still show high rates. I don't know if you can pull up for me the graphics of the demographic comparisons. It should be coming. There we go. Yeah.
Oh, wow.
So this is actually, I pulled this from the HIV.gov website. So the blue bars that you see there are the 2014 numbers, and the red bars are the 2018 comparisons. As you can see, for the most part, for a majority of these chosen demographics, the rates have gone down. If you see the African American gay bisexual men category, it used to be 9,800 back in 2014. We're at 9,400. So again, it went down. So that's a good trend. The one that really struck out to me, and that's really relative, that there's some relevance here in Miami-Dade and Broward counties, is the Latino one, where if you can pull it up one more time, the graph to show the audience. The amount back in 2014 was 7,500 for Latino gay and bisexual men, but it actually went up to 8,000. So, it begs the question, what is it, what is it that's making these numbers go down, go up, and whatnot? Could it be testing, which is one of the reasons why today we'll be talking about the home testing program that we have.
Yes. All right. Well, thank you for that, Jairo. So I'm going to pose this question first to Rick, and then Jairo, you can chip in. But in which ways has COVID brought attention to and or taken attention away from HIV?
Well, I would say when we look around the country and talking to my counterparts that cover the other territories and other states, is a lot of the testing is kind of dropped. They are still providing testing. They are looking at ways to innovative ways to continue to provide testing, especially in offices. One of the things that we did back in 2012 is we launched an in-home HIV test based on our professional HIV test. And our professional test can be done with oral fluid or finger stick. Our in-home test is oral fluid, making it easy. It's 3 easy steps, very easy to use, but also very, very accurate, over 99% accurate. We can detect HIV antibodies as early as 20 to 25 days after infection. So when you kind of look at what this test can do, the in-home self-test, and you look at what COVID's done to just, not only just to HIV testing, but to healthcare in general, less appointments. You can't go to the emergency room because of, what's going on. I think, what was it, yesterday or this past week, who said, dental offices. So when you look at all that kind of activity or services kind of just decreasing, how do you continue to provide HIV testing? And, using the in-home HIV test, also looking at ways to do the professional HIV test in your offices. I know Care Resources also doing some of that in their offices by appointment only. So, you look at all that and you just kind of say, hey, here's a solution for COVID. Here's a solution to continue providing HIV testing outside of COVID.
Absolutely. Jairo, is there anything that you'd like to add to that?
No, exactly what Rick was saying. I also like to add as well that COVID definitely has changed the way not the landscape per se, but it has changed dramatically, like how confident people want to come into the office to get tested. And thankfully, Orasure has this product that allows clients to basically go online, make a quick submission. We give them a call. We give them the test to do it at home. It's much more comfortable for them. But additionally, I know that there's some clients that typically, maybe are afraid to go to the office. This also is a nice addition for them. Another service that they can utilize to get tested in the event if they have like a fear of going into the office, for fear of retribution, for fear of being seen going inside or anything like that. It's a nice little extra.
All right. Well, that actually smoothly guides us to our next topic, which brings us back a little bit to February, right? Because that's when things were still kind of cool. So we're going to now discuss how testing was then versus how testing is now. Okay, so let's go back for a minute. It's February 2020, and someone needs to come into Care Resource or any nonprofit organization or clinical setting, and they are requesting an HIV test as well as STI testing. What exactly was that process like then in February 2020?
So, it was a very, very easy process. Person comes in, they sign in. It was normally just a walk-in process. If it's first come, first serve, there wasn't any capacity issues in an office setting. You didn't have to worry about social distancing, obviously. In regards to STI testing, that's, obviously blood draws. They have to be close to the person, obviously, was a thing. Chlamydia, gonorrhea testing, especially with a throat swab, that was doable in the office. But a lot has changed ever since March. A lot.
Yeah. So much. And we're nearly 6 months into all of the changes and a complete overhaul in how not only we interact with clients, but how we do business as usual. So can you just share what changes have occurred since COVID changed the way we live and go about our health screenings?
Yeah, so I still remember in March, there was a drastic slowdown because obviously we had to we didn't know anything about the virus at the time. We weren't sure how virulent it is. We weren't sure, to what degree, was it just breathing? Was it droplets? We didn't know all that. So we had to take extreme caution. We had to, we normally have 2 testing rooms in our Midtown office, our main office. We had to actually do testing in the laboratory, which is, we only have 1 in that health promotion location that we have there, which obviously limited our flow. We didn't do the blood test for syphilis for a while because, again, it required close contact. PPE, I know it took a while to get there. I know with the whole United States, there was a shortage of it. And then really the only thing we could have done was the HIV swab test. We actually couldn't do finger sticks during that time frame, and the chlamydia, gonorrhea, urine, and the throat test. But the clients had to do their own throat swab outside of that lab setting. It was a pretty tumultuous time, I will say. Yeah.
But you made it through. You made it through because I know that there were so many uncertainties in March, but through and through, we've still consistently had clients come in looking for services, but we've also had to adapt to the times and make sure that we were still giving access to services, however, making sure that safety was a priority.
I'm sorry, I wanted to add also as well, what was actually very interesting too, was even during that initial COVID outbreak, I would say, the amount of people coming into the office, weirdly enough, didn't really, how can I say it? I mean, obviously our processes had to slow down because we have to take extra precautions to clean behind every client, make sure everything's disinfected. But the amount coming into the office kind of stayed the same, which tells me something, which means that even during, coronavirus, during social distancing and whatnot, people still need these services. So, the question that we had around March, April was, how can we still provide these services with these restrictions that we had? Yeah. And that's where the home testing came in, or the idea of it came in, actually.
Well, I'm glad it did, because even though this pandemic is changing the way we live our lives, health is still a priority. And we've seen a lot of businesses close, but it's really affirming and it's really encouraging to see that health centers are front and center and people are still able to go get their medications, because a lot of people were worried that things would stop, and people still were asking questions, like they just want to know, when is this going to be over? Like, you all are not closing anytime soon, right? Like, there's still this restlessness because there's so many uncertainties and unexpected twists and turns, I guess, since March. But we made it. And we're still like, it's nearly 6 months.
Yeah, I mean, thankfully, over time, as we learned more about the virus, as we learned more about its transmission methods, more things to help control the spread, thankfully, we returned back to almost normal testing. We finally are doing the regular finger stick. We're doing blood draws, chlamydia, gonorrhea, syphilis testing, and also now that we have the full PPE gear, we can do that in the office. But again, that's just the office setting. What about out in the community? What out at our community partners? That's where it gets a little difficult. And again, this is where, thankfully, the home testing program comes in and helps with that.
All right, thank you, Jairo. Rick, I'm gonna go back to you for a bit. I do know that this has obviously changed the game completely in many levels, but were there what things are Orasure doing that you could share with us in response to the COVID pandemic, and have things changed, and how have they changed since March?
I would say one of the great things with Orasure Technologies is our public health sales team is made up of public health people who have worked and have experience in working in public health. We have an STD director. We've got a couple of those. We've had a couple of the state AIDS directors. And so when COVID did hit in February, March, one of the great things about this team is we come in and we help provide solutions. And with the in-home test is a solution. Being able to have a test to provide to clients to go home, their car, wherever, to kind of do a test to continue to make sure that they are HIV negative, and if they're positive, get into care. One of the other great things about Orasure Technologies is the ability to basically react and respond to a public health emergency. One example recently was Ebola. So we have a rapid Ebola test, we have a rapid flu test, and now we're working on, we know we have the in-home HIV test, the self-test, and now we're working on an in-home self-test, a self-COVID test that will hopefully come out later this year. And we're making, we want to make sure that it's accurate. We want to make sure that it's still going to be 3 easy steps, hopefully. But, we have the ability to respond pretty quickly. We announced this week through a press conference that we've expanded our company size. We've basically doubled to ensure production of the COVID test, but also to ensure production of our HIV, our rapid flu test, our rapid HCV test. Just to make sure that we've got enough people on hand to produce the tests.
That's awesome work. Keep it up. Keep going. So now that we know you all are working on all of these things, there's still a question that people have. There's all these tests I have to do. Why do I have to take all these tests? And when it comes to HIV, it's still very unclear as to how and when someone should take an HIV test. So we're actually going to switch gears and start talking about how often we should be getting. Okay, so HIV test. There's very much, I wouldn't say a discrepancy, but there's obviously a different scenario for each individual. No one's sex life is the same, correct? So let's see, who am I gonna go first? I'm gonna go with Jairo first. There's obviously a recommended frequency as to when someone should take an HIV test. But I'm guessing, let's go ahead and just see what is like the average. If we're taking anyone in the USA, an average individual, how often do you believe the recommended number of times per year that someone should take an HIV test?
The CDC recommends at least once a year, which in my opinion is not that much at all. For anybody who's sexually active, I always tell my clients every 6 months to safe bet. Even if they're in a relationship. And then for anybody who is very active, I'm trying to think of what will be a qualifier for very active. 3 months.
Sex work, possibly, potentially.
Exactly, sex work. Just more than 5, 10 sex partners, inconsistent condom use, injection drug use, maybe. All those factors. I would say every 3 months, just because with HIV you never know. Sometimes people don't get symptoms, and people sometimes respond. Not respond, but like they react whenever something feels wrong. They'll go to the doctor. But what if you don't have symptoms? So that's why I always tell my clients every 6 months, as a kind of like as an extra to the CDC recommended one time a year if you're sexually active. But every 3 months, if it's like you mentioned, like if it was someone who was engaging in sex work, has just a lot of sex partners with inconsistent condom use, all that. So between 3 to 6 months, I would say.
Okay. And so with that in mind, Rick, I'm going to go ahead and just ask you, there are different tests for different things. Obviously, an individual who is on PrEP, for instance, they'll get like a fourth generation or an individual who is going to a clinic and they have the rapid test and they're getting like the Lancet or getting a swab in some cases. But keeping all of this in mind, do you think that there is a difference? Like what is exactly the difference in each of these tests? And is there one that's, I don't know, like I know you mentioned one can detect up to 20 to 25 days after infection, but is there one that is superior in any sense? Because a lot of clients and patients tend to ask, which one is the most honest one? Which one is, you know, the most? There's always those interesting questions. So, what would you like to shed light on in regards to that?
You know, I'm biased, so of course I'm going to say Orasure. The OraQuick test is the best. I've been working in HIV since 1994, and I've been a customer of Orasure back when they had the Orasure test, and then when the rapid test came out in 2002. I will say that I have used and worked with a lot of the tests that are in the market right now. When you look at, you know, 3 easy steps, the ease of use, you know, for a counselor, you know, like Jairo and his staff, Ron and his staff, you know, is it easy to use? How accurate is it? And, you know, when you look at that and you see, okay, it's 3 easy steps compared to some that could be, you know, 5 to 7 steps. And sometimes some of them look like you're like kind of running a small little science experiment. But, you know, 3 easy steps, not just for the tester, but also for the client. And then when you know, talk about accuracy and sensitivity, try saying that 3 times fast, right? When you look at that and you figure out, you know, this test can now detect HIV antibodies, and there's HIV IgM, which is very specific antibodies to HIV. And when our test can pick that up anywhere from 20 to 25 days after infection, you're like, wow. Back in the day, it used to be, you know, you'd have to wait 3 months, as Jairo was saying, to get tested to, you know, if you were exposed, you had to kind of get a baseline and then wait 3 months and get another test. Now you have the ability to wait 20, 25 days after exposure, get tested. You know, I come in to see Jairo, I'm HIV negative, feel great. And knowing that this test is accurate, so I feel good about it, but, you know, we have to come back in if high risk and such. So, you know, when you just look at, for me, when I was running testing programs for, you know, the different states that I worked in, I, again, looked at ease of use and accuracy, just to, you know, and, you know, when you look at that and you compare it, you know, compare that to the OraQuick in-home or the professional test, it's almost a slam dunk, home run, whatever you want to, you know, whatever your preference is.
Yeah, and also additionally with the OraQuick system, there's also inherent flexibility as well. Not only can you do it through a little finger stick, but also through a mouth swab. Some other testing technologies don't even allow for oral swab. So that's actually was especially during that February-March coronavirus kind of outbreak at that time, really made a difference. You know, in giving our patients access to HIV testing, even, you know, in a case where we couldn't even do, you know, we couldn't get too close, or, you know, we didn't know what the transmission method of coronavirus is. You know, that really helped us out a lot, that flexibility. And
you didn't lose any accuracy for the test.
Correct. Yeah, it's still, yeah, or like I think it was 99 point what again percent effective?
99.3 for oral fluid.
Yeah. So basically over 90%.
Yep. So.
Okay, well, I guess that answers a lot of doubts. It's just important to note the comparison because there are a lot of options for the testing, which is important. Just like if someone is living with HIV, you know, they need specific testing early on in their diagnosis and then continually throughout their care. You can't just get a blood sample or get a finger prick. Like there's specific needs for each client and each patient. So I'm glad you all gave just a little bit of detail to clear up some of the questions for some people. So we've talked quite a bit about what tests are out there and how to test, but I would like for us to switch into how to take the test itself, the at-home test in particular. Okay, walk with me real quick. I am going on to careresource.org/home testing. I am registering on the website, giving my consent. I get the letter, I get the package rather, and I have the ability to take the test. Walk me through this, please. Walk the audience through this.
So I noticed that Rick and I also have the test in hand.
Yes.
Just so that we can both, I don't know, Rick, do you want to demonstrate how to do it, or do you want me to demonstrate it? How would you like to do this?
It's completely up to you. I'll let you do it since you're the expert down in South Florida.
So once you do the submission, once a counselor is over the phone, talks with you, goes over your risk factors, they deliver the kit to you. It won't be like this. It will be in a not in a box, but one of those I keep forgetting what they're called, the little like manila, not a folder, but like those closable folders. Keep forgetting what they're called. But they come in this, and I apologize for that. There's an Amber Alert that just came on.
Oh, geez.
You'd open it. You would open it up, and in here you would have a nice little. It's hard to see. I do apologize. A nice little kit in here. Once you open it, the good thing about this system is that everything, all the instructions, are all here in English and Spanish. So that's another benefit as well of the of using the OraQuick to have it already prepared in English and Spanish for any clients, especially here in Florida, which a good amount of them actually were Spanish speaking only. In here explains what to do beforehand, not to drink or eat half an hour before, how to do it correctly, how to swab it correctly. Even has a little place over here to, I'm sorry if you can't see it, to place the actual tube and the little dipstick right on there, and explains. It also shows how to interpret the results, if it's negative or positive, and yeah, like I said, it's very self-explanatory. The times that I've done testing for the clients for the at-home program, we always tell our clients that if they have any questions or concerns, they can give us a call. We'll walk them through it. For the most part, they think they've gotten the hang of it. So that's the really cool thing about the at-home testing program is that if you since the instructions are here, it's basically you can do it on your own. But if you ever have any questions, just call up your counselor. They'll walk you through it. That's what I really love about the system.
I do want to add to that is, not only can you call Care Resource, but you can also on the box and everywhere on the box, outside, inside, there's an 800 number that you can also call, that you can reach. And if you have any questions, you can ask them. You can say, hey, I'm, Rick, I live in South Florida. How do I get a hold of someone? And they will actually, you can say, I want to go over to Care Resource. And they can do like a warm transfer. But, it is English, Spanish. Every page is very detailed.
Yes.
So it's very, very easy to use. Like I said, 3 easy steps. And the swab literally is, and I'll just demonstrate how easy this process is. So the swab, you just put it between your cheek and your gums, and then you're going to swab once across. Then you're going to go down, once across, and out. So it's just like this. And then it's out. That's it. You put
Almost
it
like brushing your teeth.
I'm sorry?
I'm sorry, almost like brushing your teeth, almost.
Yeah. One swab out, stick it in the vial. You let it sit there for 20 minutes, and you get the result. Like I said, it's a very accurate test.
Yes. Yeah. I also wanted to add as well that hopefully, and I know we're going to get to this topic, I think, a little bit later about the results. What if it comes out reactive? I don't know, Kishi, we're going to touch on that later.
Yes, my
Okay,
apologies.
no problem.
I had some issues with my laptop. I don't know. I got the Amber Alert and then I lost power. So strange.
No problem.
But I'm here. I'm here, just like Care Resource, still doing services, still getting the job done. It is what it is. Um, but I did not see the demo. I'm not asking you all to do it again. However, you did the demo, correct?
Yeah. So just to catch you up to speed, yeah,
Am I
we
right or am I wrong?
I showed. No, we did. So I talked to everybody about how the test looks like, how it comes in, that all the directions really it's all in here, very easy to follow, and that if there's any ever questions, okay, just call up your counselor. They'll be able to help you through it. Very easy to use. Very easy to use.
Okay. So I think we should move on. I think we should move on to any anxiety or fears that people coming in to receive a test may have. Because I'm sure like getting tested for anything is very much a source of frustration or fear or restlessness for folks. So we're gonna switch into that next. So Jairo, can you hear me?
I can hear you.
Okay, great. So can you tell us again how long you have been a testing counselor?
Oh, I want to say a good 4 years now.
All right. So 4 years, I know you have done at least at this point thousands of tests. You provided many tests for many of our clients and patients.
I'm doing the math in my head
And
right now.
while I'm
Probably.
sure, oh, you're doing that. Okay, you've done quite a bit of tests in your tenure. Um, I know that many times you never know what you're going to expect when someone comes in and they want to test. There's a lot of people, I'm sure, who come in consistently and
Hmm.
they know what to expect. But
Yeah.
there are also some people who may come because there's something that they're very concerned about. Um, but if you don't mind, what are some of the, I guess, common responses or common fears that you've experienced personally as a counselor from the clients? I know many of them, like I said, come in and they know what to expect, what others might be on edge.
Hmm. I would say the most common is just kind of shyness, I would say, because sex typically in the society is one of those subjects that's not talked about. It's a little taboo, I would say. That's one of those, I would say, not a fear, but an anxiety. There's some people, and because of that, some people, let's say, if they are a man who has sex with men, they'll say women instead because maybe they're afraid of getting judged by the counselor, which, again, our job is not to judge. Our job is to help understand risk factors, educate. That's our job. Um, Another source of like anxiety and fear is, what if their test comes out positive? Which, understandably, it is a fear for people. Um, and I feel like a lot of that can be mitigated with education, whether it be on your own or the counselor educating you around those topics, or kind of having that nice warm atmosphere where you don't feel persecuted just for talking about it or feel that way.
Okay,
Mhm.
thank you for sharing. Um, is there ever any, like when you see that someone is nervous or someone is shy, or you can tell that, like, the ugly head of stigma is rearing, and it's really making it difficult to get through the process. Is there anything that you've been advised to do, or is there any way that you kind of encourage the client to, you know, reassure them that they're doing the right thing by being here? Is there anything that you've done or anything that makes the process less tense?
I mean, one of the ways that counselors can find out if the client's not actively saying it, their body kind of does. So, kind of being observant of body language helps in identifying that. And then, in regards to try to get the person to basically come out of there, not even more anxiety ridden. I would say trying to, again, this is the way I help clients who have that anxiety, that level of anxiety. I try to, oh my God, there's so many techniques in my head. I'm trying to think of one of them right now. It's just basically bringing it down to earth, letting them know that, it happens to everybody. And also that, we make mistakes, but that's how we learn from them, I would say.
Awesome. It's interesting. I remember myself being I guess I was a client. Yes, at other places, like just doing it routinely. Like I personally would go every 3 to 6 months to organization and get it done. And even though I pretty much knew what the result would be, I think because I grew up in a household where we could talk about sex and we could talk about safety and we can talk about relationships. It made it easier for me to be proactive about getting tested. But I still think there's a lot of stigma today. People know about PrEP, but people are always asking, "Where's the cure? Where's the cure?" And we're still hearing people, wonder if there's a vaccine. I think there was word about vaccine because people sort of treat HIV like it's not around, but yet they still treat it like it's something to be afraid of and ashamed of. It's the strangest thing. But I do think most people still have some sort of fear around it.
Yeah, and a lot of that stems from, back in the 80s and 90s. Obviously, that was a scary thing back then because we didn't know much about it at all. But then you fast forward till now in 2020, we've learned so much about it. Like we've learned how it replicates in the cells. We learned the medications that fight it, which there's like 5 or 6 different classes, if I'm not mistaken. I keep forgetting what the exact number is, that we didn't know before. So really, and then obviously, if someone has all that information, it becomes less scary once you learn all about that, all of that. It's almost similar, believe it or not, to coronavirus now, where back in March we didn't know anything about it, and obviously we have our our fears about it because we don't know anything about it. We don't know how it spreads. We don't know how deadly it is, et cetera, et cetera. But then now we fast forward till now, we've learned a lot more about it. It's as long as you're wearing a mask, keeping your 6-foot distance, you're following those guidelines, you'll be mostly good. Same thing with HIV. As long as you use protection, are on PrEP, talking, communicating with your partner, it makes a difference.
I agree. So thank you for sharing all of that. Now we have actually reached our last segment and our last question. Obviously, getting tested is a bit of a process. And sometimes the result does come back positive or reactive. So we're going to discuss what to do if that indeed does happen.
Hey, Kishi, are you there?
All right.
There we go.
Let me start with, is Rick still with us?
I am. Can you hear me?
Yes, we can hear you.
Okay.
I am. All right. I hear you. I see you. Okay. So I just wanted to, because you work with the tests. These tests have been utilized for years to let people know information that's very important and essential to their health. So I mean, how is that? How does that process work of like, okay, knowing that you are making these tests, and are you aware of like what people are able to do afterward? Because the testing is a very essential part of not only finding out if it's negative or positive, but also ongoing even after, like, the tests are essential. So just give me your thoughts on how that works and how you all feel about all of that.
I would say, one of the things, with the in-home test is, there's phone numbers that you can reach out to. Also, when you talk about, just HIV testing and knowing that there are now medications that can help to ensure that, you stay healthy. When you look at that and you look at how these tests, we're talking about stigma and testing, we've done a lot to kind of take some of that stigma away, so that someone doesn't feel so much pressure when they do go get tested, and they feel, it's okay if I do test HIV positive. There are things that, can happen to make sure that I do stay healthy. So does that kind of answer the question? Because you were breaking in and out.
All right. Thank you so much for that.
Sorry, and like I said, I hopefully answered the question. You were kind of breaking in and out. So.
No, you did. Jairo.
Yes.
So you work in Care Resource. Can you give an internal walkthrough of what the options are, or what it may look like once someone does get a reactive or positive result?
Yeah. So hopefully, this never happens to anybody, because it is a very stressful experience to go through. But say, you have a client who does the home test. They report to the counselor that the test comes out positive. The first thing is obviously to talk with the client, see what they're going through. There could be a lot that's going through their head. Then from there, we ask if the client can come to the office. Obviously, as I mentioned earlier, we obviously disinfect the areas where clients will be sitting on a regular basis to make sure everything is safe, to prevent any sort of COVID spread. We want to make sure that doesn't happen. But in there, we'll talk with the client more. We'll do the test again in the office while the counselor's there. Just as a just in case. And then if that comes out positive, we do have what's called the test and treat program at Care Research, which basically means that if I test positive, in that same day, I can register to be a client, I can see the doctor, and I walk out with the medications the same day. That is a huge benefit for the client, because they don't no longer in the old I want to say maybe years ago, when test and treat didn't exist, they don't have to wait a week or two to get that. I'm sorry, the phone got up here. To get the medication, which during that time frame, what if the client loses their any form of transportation, or what if they have any difficulties? It reduces a barrier, or it takes on a barrier to care. And then that also, what's what I'm looking for? It also keeps them engaged, I would say. And also, again, since they speak with the doctor the same day, we know that clients do take a provider's words pretty seriously. So hearing it that first day can also, make them a little less fearful of like their new diagnosis. Yeah. I think there's a delay.
Did we lose him? Is he there?
He's there. I think there's a delay.
Okay.
Yeah.
I'm here. I'm here. You know, just my feed gets a little bit, just a little bit slower than the rest of you. But I heard you loud and clear, and I appreciate you for giving the audience that info because it's very important. At-home testing is still fairly new in the grand scheme. Most people probably do get an HIV test, at least in South Florida, to my knowledge, either from their doctor or from a nonprofit organization that provides complimentary testing. Um, but I would love to see more people take at-home testing because HIV testing is important. Sexual health is important, and a lot of people are not encouraged or motivated enough to get out there and test for HIV. And I think part just like COVID, and more people get tested and know what's going on in their bodies, more people will be not only informed, but hopefully empowered. And it influences the choices that we make. And it shouldn't be something that is shameful. It should be something that gives you an opportunity to better yourself because there are so many people living with HIV right now who are very healthy, who are taking their medication, who are seeing their doctor quarterly, and they're living, they're thriving. And obviously, we need more people on antiretrovirals. There's not everyone who is living with HIV is in care or has access to their antiretrovirals. However, we do know that not only when people are on antiretrovirals that they are healthy, but they're also when they reach undetectable, U equals U, they're not able to transmit it to someone else. And that is how we end the epidemic. Because now we have also a pandemic. So we need to, I guess, I don't know if the word is unilaterally, but at the same time, give me a cute word. I don't know. I'll figure it out later and I'll be ready for the next health connection. But I just think at the same time, you can address two different things and come up with solutions at the same time. I understand the importance that it was needed to put attention to COVID because people have literally, so many have died. And so many have gotten sick. However, HIV is still here, and we can prioritize COVID for now. However, HIV's been here, and we've lost a lot of people to HIV. There's a lot of people living with HIV. We just want more people to be proactive, and however we can get those living with HIV the help they need, and those who are not living with HIV to stay HIV negative. I think we've done a great job because I'm sure COVID may or may not come and go, but HIV is something that still deserves importance. It's still here, and we're gonna kick it right in the butt, and you all are gonna be there with me. So I'm not sure if we have any questions. However, if you two want to say anything for the last 2 minutes, you can.
Yeah. No, I actually wanted to add a little bit about what you mentioned, that the HIV home testing, by an organization or an agency, that is still kind of new. It still kind of is. In fact, actually, I know when I went to a conference last year, that they were actually talking. There's something called implementation science. That's such a fancy word, but basically, it's the study of I guess of a implementation, I guess. But they were talking about home testing and what was it? What populations can it reach? And then one thing that they mentioned was that it really reached out to the people who are hard to reach. So, for example, the people who do come to the office because, again, that they're afraid of going to the office, like I mentioned earlier, afraid of being seen, being somehow not related is not the word, but like somehow if you go in there, you have HIV, etc. All those fears that people have. It reaches out to more of those people. the people who have never tested for the first time, as I mentioned, and even right now, mostly the young folks. So they're seeing with initial study results that it's reaching out to more of those individuals, which is good news always, because as we know, the age range of around like 18 to 39-ish, more or less, is a high risk group for HIV.
All right. Thank you
Oh.
so much, Jairo. I miss you. I hope you take great care of yourself. Rick, nice to see you. Hope to meet you at some point.
Yes.
Please keep doing the work you're doing. Yes. Thank you for everything you've contributed. We hear you, we see you, and we thank you. Everybody, take care of yourselves. This was another episode of The Health Connection. I apologize greatly for the issues. However, we'll be back and we'll do better. And we thank you.
Thank you.
All right. Thank you
Take
very
care
much.
of yourselves. Have a great weekend.
Everybody, have a good weekend.
Thank you.
Don't forget to like us on Facebook
Yes.
at facebook.com/care resource, or follow us on Twitter at care resource FL, or subscribe at youtube.com/care resource. For more information or to find a location near you, visit us online at careresource.org.
Would you like an HIV test from the comfort of home? Care Resource offers no-cost rapid HIV testing for those who qualify. To learn more about at-home HIV testing, visit careresource.org/home testing.
Steve, are you